going to do is we're going to be treating half of the back with the 755 nanometer wavelength of light and the other half of the back with the LightSheer Duet.
You can see an imprint right here of the treatment area. So again, just as an overlap, we're not actually going to fire the laser, but just so you get a sense, this was the treatment area previously, so you get a sense of the spot treatment from a comparable laser device used for a similar patient. Okay, ready, Laysan? Yeah, so we'll take a moment to stop here just a second. So you notice I've almost gotten done with about this much of the back, about halfway up the back, and Laysan, you got up about here, is that right?
That's right.
So we'll ask the patient on your left side, which was treated with the LightSheer Duet, about how uncomfortable it was, and he's indicating a 2 out of a scale of 5, with 1 being just very minimal pain and 5 being the most extreme pain. And then if you can also, if we may ask you on Laysan's treatment side, which is using the Alexandrite 755 nanometer wavelength, on a scale from 1 to 5, what is your discomfort level?
He indicates a 4 on a scale from 1 to 5, with 5 being the most uncomfortable.
So he's being very brave, but we'll go ahead and continue with the treatment. So at this point, we'll take a second to stop. As you can see, I've treated the entirety of the left side of the upper back. We'll indicate again, I've asked the patient what, on a discomfort level from 1 to 5, where he is, and he's indicating a 2 again. On the right side, where have you gotten to at this point?
I'm right here at this point, and he's indicating a 4 on a scale from 1 to 5.
At this point, I've been done for about a minute or so. Say, Laysan is still working on the right side, which is the Alexandrite side. She's at this point about 2/3 the way up, and I've been done for a minute or so. As you can notice, there's very little erythema in regards to the patient, and it's been a very comfortable procedure for the patient. Again, he was indicating about a pain of 2 out of 5 on a 5-point scale for discomfort.
I had to use ice packs prior to, and the cooling device, the Zimmer cooling device, throughout the treatment to try and keep the pain to a minimal, and apparently he was still experiencing a significant amount of discomfort.
So we just wanted to take a moment after we're done with treatment to actually compare the two sides. So again, this was the side that was treated with the Alexandrite 755 nanometer spot size with some pre-cooling prior to treatment, and there was actually active air cooling during the treatment. And then this was the side that was treated with the LightSheer Duet at actually pretty aggressive settings. It was set at 11 joules per centimeter squared during this first treatment. And if you'll notice, comparing the right side versus the left, there's quite a bit of erythema. I would call this moderate erythema after the treatment. And there's quite a bit of char. If you look closely, you can see quite a few of the actual follicles, hair follicles themselves. The hair that's coming out of those have been charred and are evident on the surface. If you take a look here, I would call this pretty minimal to mild erythema. There's a little bit of perifollicular edema, which to me indicates a pretty effective treatment, that the laser light energy hasn't been concentrated at the surface of the skin, but instead has been more effective where we want it to go, near the bulb. And then Laysan spoke with the patient after the treatment in order to gauge just overall what was the pain threshold from one treatment to the next, and maybe you can talk a little bit about that.
The patient reported that my side was twice as painful as the LightSheer Duet side.
Yeah, that's pretty much it, which was consistent when we were actually checking a couple times during the actual treatment itself.